what does normal sex look like for an IC patient? I think we have to start by defining the word normal, because normal is something different for everyone. And you can find what your normative is, where you can take your sexual response, your sexual health. It is an empowerment to own that and to know your body and how to take care of it and how to pleasure it. Touch and pleasure are so much a part of the chronic pain journey, and increasing that physical response can help to kind of die down that pain. And so how do we look at that overall journey of your sexual health? Well, start by looking at different options for different ways in which you can experience pleasure. You can't have penetration because it hurts too much, because of maybe burning, pain. It makes you feel like you have to void. So maybe instead look for alternatives. Look at maybe self-pleasuring and exploring your own body. Learn what your body likes, what your body doesn't like. So many of us women don't even know the answer to that question because we haven't explored, because we haven't had that journey of exploration with ourselves and our sexual health. Many other ways can be utilizing toys as well. So clitoral stimulation is an effective form for a woman to optimize and experience her own orgasm. For women and for men, lubricants, very important. There is osmolality that goes into, as well as pH, that goes into the sexual lubricants that you choose. That can help to not only make it pleasurable, but also help the tissues get healthy. And especially if you're postmenopausal and you're experiencing severe vaginal dryness, any type of atrophy after maybe breast cancer treatments, those type of things. Looking at the health of those tissues and utilizing a lubricant, if you are trying to do things with toys, with penetration, with dilator work, you can use a little bit of a dilator just to get your opening comfortable with the idea of penetration. There are Soul Source, amazing dilators. I highly recommend them. And you can use the Desert Harvest Aloe Glide and just slowly, massage your vestibule. And over time, it's going to help make it easier for penetration and help you feel more comfortable. You can also use things like Desert Harvest Relivium. It has 4% lidocaine. Put it right in there on the vestibule. So if you do want to do dilator work, you do want to try penetration, always use that in combination with a lubricant. Back to that conversation of the lubricant, choosing your lubricant is critical. So there is something called osmolality, and this is how the fluid flows in and out of your vaginal wall, your epithelial cell layer of your vagina. And what happens is when we start adding chemical ingredients, we begin to throw off our biome. And unfortunately, most of the lubricants out on the market actually are not isoosmolar, are not meant for the vagina. So what happens is over time, they begin to dry out your epithelial cell, your vaginal wall, and it literally falls out. You've just lost your barrier of protection to STIs, bacteria, fungus. It is very, very important that you help maintain that biome, especially as you're dealing in a chronic pain journey, you're postmenopausal. It is very, very critical. And just know that the ideal vaginal osmolality is 290. And you only want to be plus or minus 80 points in osmolality with a lubricant. And most of the lubricants out there on the market are required to be FDA registered medical devices, and so those products all have that testing done because it is required by the FDA. Then on top of that, you can also just work on breath work, yoga, tantra, looking at different ways. Tantra lets you explore touch. and sensations and feelings of pleasure without any type of penetration necessary. There are options out there and ways in which, as an interstitial cystitis patient, you can experience pleasure.